I would really seek to know what advised that, why were restaurants given a priority, because there are also other places like places of worship which could also operate under similar or more strict guidelines. Number two, the enforcement of the safety of our security officers who are enforcing or ensuring that Kenyans are not flouting the curfew or the inter-county movement. I'm also worried that who is really ensuring that they are safe, because most of them may lack, let's say, masks, and also because we are in abnormal moments, the arrest of people, the way it's being done, does it really show, or does it not portray that that could be another contact of spread of COVID-19? And then lastly, what are some of the services that the government is really offering, especially to either contacts or patients of COVID-19? Because if, for example, you are told to choose a government facility, I understand there's some fee that you're paying for you to be quarantined. So is it testing of COVID-19 that the government is taking care of? Is it quarantine? Is it treatment? Kindly a clarification on that.
That's the last one.
My name is Stephen Leto from Citizen TV. I'll tie my question to the opening of food and eatery joints. My question is with regard to the testing of the staff that will be undertaking that exercise. What happens when the hundreds and thousands of the staff go to be tested? Are they tested and allowed to go back home, are waiting for the results, or they will have to be isolated until their results come out? And my last question, we've seen India have been using faulty testing kits that they procured from China. I want to know, where did we procure our rapid testing kits? And if it is the same country, are we concerned? And could that be the reason why we are having a staggering mass testing of Kenyans to date? Thank you.
Okay, thank you. I will take some of the questions, and some I will refer to Dr. Kuria. But let me begin with the last question from Citizen. And your question was about the opening of the eateries and how testing of the workers there would be conducted, given also that we are possibly dealing with a very large number of people in this sector. In fact, the figure that we have is that there are about 600,000 food handlers within this industry. So yes, indeed, it is a large number. And of course, we will not be able to deal with this large number all at one go. We will have to move progressively to be able to cover most of these workers as we move forward. We are trying to ease and reopen the economy in some way. When the pandemic is still there with us, we need to maintain that fine balance of being able to at least open up part of the economy without having to compromise on the containment measures that have been put in place and that we feel are paying some dividends for us. So what happens when people are tested and they turn out, if they turn out negative, they're fine, they're ready to go and work. If the same procedures that we are applying now for contact tracing and any testing are going to apply, if one turns out positive, then that candidate has to be put in isolation or a treatment facility. Those that, so here we do not have any issue of contacts and so on, because we're dealing purely with workers. It is only when we are dealing with a positive case and who has contacted that issues of quarantine might arise. You talked about the tests that we are using. I want to make it clear here that as of now and up to now, the tests that we are using to confirm or diagnose the presence of the coronavirus is a molecular-based test that detects the RNA of the virus. And that is the gold standard that we are applying. Since then, there are other tests that have come up that are what you call antibody-based or seroprevalence-based. These are the RDT tests we're talking about. We have a number of them here that are interested in being approved and registered in the country. There is a process that the Pharmacy and Poison Board and other regulatory authorities undertake to be able to put those on the market. As of now, we have not approved any of those because currently our biggest concern is to determine whether one is infected with the virus and not what these other tests detect, which is that somebody has encountered or has been exposed to the virus in the past and has an antibody. That might have its utility somewhere, but for what we're doing, it is based on the molecular test. Purity from KBC. You asked about reopening of restaurants and why restaurants. Let me reserve that for Dr. Kuria. You wanted to know about the safety and welfare of our security officers who are enforcing the curfew and enforcing the other regulations. We work very closely. As you know, this response is a one government response. At the National Emergency Response Committee is also composed of various ministries, including the Ministry of Interior. And all these officers have been trained and are being provided with the right protective equipment where it is necessary for them to use this equipment. So all measures are being taken to ensure that the security officers themselves are also protected because they are frontline workers. Just as our healthcare workers are frontline workers, they are those class of frontline workers and they deserve to be protected, and measures have been taken to ensure their protection. Services that are offered to contacts or their patients. You know that quarantine, the directive right now is that if you are in quarantine, if you're placed in quarantine, then you are responsible for the cost of quarantine. And that happened when we stopped the travel, international travel, and we had a lot of passengers who came in. But we have gone through that phase. Most of these passengers have been released. And right now, quarantine would be, people would qualify for quarantine would be any contacts of any positive case. Any contacts of any positive case are put in government facility quarantine, and I believe, and I stand to be corrected, but I think they are supposed to meet their costs. However, as we said, testing is conducted free of charge by the government. Testing and treatment so far in public facilities is borne by the Ministry of Health and the Government of Kenya. Dr. Kuria, maybe you can answer the question on why we picked on restaurants and not any other industry.